I'm Dr. David Hill, and today we're going to be talking about healthy infants that may have a vitamin D deficiency. Now, what's happened in the last few years is we've learned a lot more about what vitamin D actually does in the human body. We've always known that vitamin D was important for building strong bones and teeth by helping the body absorb and use calcium. What we know now is that vitamin D also has a role in the immune system, and proper levels of vitamin D may help avoid illnesses like diabetes and even multiple sclerosis later on. We've also learned as a result of that research that what we thought was a normal vitamin D level actually was not. A lot of people in the United States today are running around with vitamin D levels that are not what they should be. Why is that? Well, there's really only a couple of sources of vitamin D. One is sunlight, but because of the damage to the ozone layer, sunlight is now dangerous to us. It can contribute to skin cancer, including deadly melanoma. Therefore, we now try to avoid sunlight by staying indoors, covering up, and using sunscreens. In fact, that's very important for public health and safety. So we don't want people to go out, especially infants, and spend a lot of time in the sun because they're highly vulnerable to sunburn and later on to skin cancer. The only other dietary sources of vitamin D are oily fish, things like salmon or herring, or even anchovies, or alternately vitamin D enriched dairy products such as vitamin D milk. Now, milk doesn't normally have vitamin D in it. Cows don't put vitamin D in milk, but we add vitamin D to milk and formula to help the people who drink vitamin D enriched milk products have a high enough level. Unfortunately, you'd have to drink a huge amount of milk or formula to get adequate vitamin D from your milk. This is true as well of infant formulas. You'd have to drink 32 ounces a day. Now, at those levels, if you're talking about cow's milk, you run into problems with anemia and constipation. With formula, that's fine, but there are not a lot of babies who drink 32 ounces of formula a day most days. Babies who are breastfed really are getting very little vitamin D altogether. So, what we want to do is supplement vitamin D, not only for infants, but for children and even adults at a level of 400 international units a day. Now, you can buy vitamin D drops, you can get Trivisol or Polyvisol, which are formulas or formulations of vitamin that include A, C, D, and some others. The D is the only part we care about. How would you know if your child were vitamin D deficient? Well, the signs of vitamin D deficiency only occur when children are severely vitamin D deficient. Those things may include abdominal pain, constipation, lethargy, poor bone growth. But most of us are not running around that vitamin D deficient. That said, without appropriate supplementation, infants may not have an adequate vitamin D level. So, regardless of whether your infant is nursing or on formula, unless he or she is taking greater than 32 ounces a day of formula, go ahead and make sure that they're also getting vitamin D supplementation with one of those products. Talking about vitamin D deficiency in infants, I'm Dr. David Hill.